From 27 suspected cases, the number of people under investigation for novel coronavirus is down to 24 as of Tuesday afternoon. Yesterday, there were 11 cases, then the numbers more than doubled. Here's the breakdown. 18 suspected cases in Metro Manila, 3 in Western Visayas, 3 in Central Visayas, 1 in Eastern Visayas, 1 in Mimaropa, and 1 in Northern Mindanao. Out of 27, 3 have been medically cleared.
First was the patient from Cebu, who was diagnosed negative for nCoV 2019 and is asymptomatic. And then 2 other patients who have now no illness, and the test showed that it was some other pathogen, some other virus.
So far, there are no confirmed nCoV cases in the Philippines. The local government is making sure it doesn't make its way to the country, or if it does, they are prepared at the very least. There's now an interagency task force on emerging infectious diseases. It's made up of several agencies: Foreign Affairs, Interior Department, Justice, Labor, Tourism, Transportation, Information and Communications Technology, and of course, Health leading the group. Present during its first meeting were Overseas Filipino Workers Affairs and airport representatives. They have agreed to ensure support for OFWs in China. They are coming up with detailed transport and quarantine plans for OFWs in Hubei province who will volunteer to come home. Once they reach the country, they will undergo a 14-day quarantine. Health authorities have already prepared a quarantine facility for easier management. The Foreign Affairs Department says there are at least 300 Filipinos in Hubei.
For Filipinos who wish to stay in China, DOH reiterates adherence to advisories and cooperation with public health activities being done by local authorities.
As of Tuesday afternoon, the number of confirmed nCoV cases has increased to more than 4,500 cases globally, with 106 deaths. This now accounts for less than 3% mortality rate, while there are over 900 reported severe cases. World Health Organization says the risk of the virus spreading in China is very high, while in regional and global levels, it's classified as a high risk. Even then, authorities do not see the need for a voluntary quarantine for all passengers from affected countries coming into the Philippines.
That would mean that you have to quarantine people coming from 36 countries, right? So what we are trying to do is our risk assessments are focused at minimizing disruption of social life and minimizing the risk to the community.
Health experts say there's also no need to wear masks throughout the day.
If you're visiting somebody in a healthcare facility, you're visiting a crowded place, a wet market, you may want to wear a mask.
They're urging the public to remain vigilant, practice good hygiene, observe proper cough etiquette, maintain distance from people manifesting flu-like symptoms, and cook food properly. Trisha Tarada, CNN Philippines.